Hi everyone, this is Dr. Susan Brown again. We had a little technical difficulty. I hope you can hear me now. And if you can't hear, just send us a little message and we'll try to figure out what's going on. But I think we're all set now. I want to answer a few questions that have been written into me, and then we're going to save some minutes if you want to write in a new question. We have a question here from Barbara, or actually Susie, who says that her doctor says she's 57 but has the bones of an 80-year-old. She actually had a small fracture and some surgery for another reason that wasn't related to bone. The interesting thing about Susie's case is after she goes through a little bit of her history, she thinks that a lot of the damage had to do with using Advil on a regular basis. Now, while I agree it's not great to use Advil, I'm not sure if it's that cause of the bone loss. I would certainly do a more comprehensive workup. Whenever we see a fracture, we always say we should do a careful workup to see what the cause of bone weakness is. In this case, Susie's talking about being a vegan for 27 years. And with no offense to anyone, I've got to say vegans are notorious for having low bone density and actually in fracturing more. And part of it is because they simply don't get the nutrient density that we need. I write about this in my blogs. I'll be happy to write about it again, but I would be very careful, Susie, to check my protein content, the B12, folic acid, iron, manganese, zinc. All these things are really hard to get in a plant-based diet these days, particularly if you have any digestive problem or you have a higher need for these nutrients than another person. So any kind of fracture, you want to get a very complete workup, and you can refer to my medical osteoporosis workup. That's on the betterbones.com website. We list all the tests the doctors should do if they want to look for hidden causes of bone loss, if they want to see if there's any hidden causes of bone loss. The other question, another question that came up a lot was about parathyroid hormone. And parathyroid hormone is very interesting because that's the hormone from the glands right on top of the thyroid. They're little glands on top of the thyroid. And their job is to control blood calcium. Blood calcium must be very specific because it regulates things like heartbeat, nerve functioning. So the body works hard to keep blood calcium stable. When blood calcium gets low, it draws it out of bone and puts it into the blood, and it also causes the absorption of more calcium. Parathyroid is in charge of monitoring blood calcium. When blood calcium gets high, parathyroid sends a message, stop absorbing calcium, put calcium in the bones, don't put it in the blood. When it gets low, when blood calcium gets low, parathyroid sends a signal, increase the absorption of calcium, raise up the blood calcium, take calcium out of bone, and absorb more calcium. Once in a while, maybe a few per 1,000 people develop a strange tumor on the parathyroid where they actually get overactive. The parathyroid starts putting too much blood in the calcium, breaking down too much bone to put calcium in the blood, and that is called a disorder of hyperparathyroidism. The general mainstream solution is to cut out one of the parathyroid hormones, and they can actually scan your glands and see which one is overactive. For example, one of the clients writes about this, that she knows she has hyperthyroid. This is Celestine, and she knows they're going to operate sooner or later, and she wants to know if she can regain the bone she's lost. And I will say, Celestine, that once you treat parathyroid hormone and once you reduce the withdrawal of calcium from bone, which is caused by high parathyroid, I do see people regain bone. So you have a pretty good situation there once they do the surgery. You want to be really careful to get all the key nutrients. You want to be sure to do the exercise. You want to be sure to alkalize and even make sure your digestion is in good shape. But the parathyroid hormone can really can make a big difference if you have that problem. And also, Will was mentioning, too, that he tends to have high parathyroid. His case is interesting because he says his vitamin D level is okay, but his calcitrol is actually his vitamin D level was on the lowish side, but the calcitrol was high. That's another interesting issue where there's the functional test for vitamin D, which we call the vitamin D test, and then there's a test for the active hormone. And if those are different, the doctor should really think about that. Actually, when you get to parathyroid hormone, you're really talking about having physicians who specialize in this, like endocrinologists. And of course, the Norman Clinic in Florida is famous. All they do is parathyroid research. They have a great big website. And it's good to look at that. If you think you have a parathyroid problem, talk with your local docs, and you can learn a lot about parathyroid on the Norman Clinic parathyroid website. But if you get the parathyroid corrected, you can indeed build bone. We always say do every step of the Better Bones, Better Body program, though. Be sure to do every step once you have the surgery and as you go into the surgery. Another question, a person says, I'm 5'2" with a small frame. Would I fall into the category where my DEXA scan may underestimate my bone density? This was by Barbara, and this shows that Barbara's been listening to what we've been saying for a while. The bone density tests, as we know them today, are really aerial bone density measurements. In other words, they're not true bone density measurements. They don't really measure the density per se, but they are very influenced by area. And so what happens is larger bone people get better readings and smaller bone people don't get such good readings because they have much less area. So if you're 5'2" and small framed, we're going to presume you have small bones by the small framed and probably that you're lightweight. So it's very possible that your bone density is a little bit lower on the DEXA score than it really might be. It's a very interesting thing with thin people because thin people as a whole tend to lose more during menopause if they're a woman, and it's very unusual because it's a loss that's very hard to stop after menopause, so you want to pay special attention. Well, I mean to say during menopause, the first 5 years after your last period, you want to pay special attention to do a strong bone building program at that time. And then it's very peculiar because thin women do fracture more. They fracture more in the hip. Not so much in the spine, but there's generally twice as many hip fractures in thinner women. Now, part of it may be because the average hip fracture is at age 80, and the people are kind of weakened by them, and they actually perhaps even lost weight. Because remember, one of the biggest risks for osteoporosis and fracture is losing weight as we get older. So maybe perhaps these people have been sick, they lost weight, and the fracture was just a part of that. Their thinness was just a part of the losing weight. But if you start out low weight young, low weight at middle age, you want to really work to make those bones strong because you do have a greater risk of hip fracture. And again, we'd say go back to every step of the Better Bones, Better Body program. Say, well, I don't know where to start. You can certainly look at my website. You can look at our books, and you can get our starter kit, which is like an at-home program that has everything about the alkaline diet, how to test your diet, everything about exercise, our meditation CD. It's really a comprehensive way to do the program at home. If you're thin, pay special attention. Christy asked about hormones, and she says, how much do adding hormones help bone loss? What happens is hormone therapy was very popular for bone loss until about 2006, when they did some studies and found that it was just too risky. Too many problems with heart disease, too many problems with cancer as a result of using hormone therapy. And so recently, various American medical associations and European associations have really taken estrogen replacement therapy off the list of good therapies for bone because they're just too risky. They're sometimes used in low dose around menopause to try to limit the menopausal damage, but it's really lifelong exposure to estrogen that's the problem. Even if a woman starts menstruating earlier in her life, she's at higher risk for breast cancer, ovarian cancer, uterine cancer, all these estrogen-induced cancer, just because she's had a longer lifetime exposure. So I personally, and at the Center for Better Bones, we favor working with nature. Nature says let's cut these hormones, say at 50. We really believe there's a good reason nature did that, because these hormones can be very proliferative, very dangerous. And even natural hormone therapy is still estrogen therapy. And in fact, I have yet to see a very good clinical trial showing that natural hormone therapy is safe. All that being said, some women love to do it, some women feel good on it, and probably the truth be that some women are not at high risk of, say, for example, breast cancer. But if you are at high risk, I'd really be very cautious about using estrogen therapy for bone. Estrogen has a moderate loss. It can moderately help reduce bone loss and reduce fracture maybe by 25%. My studies suggest that vitamin D can as be effective if you get that vitamin D in that, say, 40 to 50, 50 to 60 level, blood level. But Center for Better Bones, we try to use natural therapies, work with nature as much as possible. Let's see what else we got going here. Sometimes people ask that they might say they might have a spinal bone density of -3. This Lori writes, and she wants to know, she's exercising, supplementing, watching what she eat, and her doctor says she has no choice but to take drugs. Well, you always have a choice. You're totally in the driver's seat, but you do want to find out if there's any underlying cause. Here at the Center for Better Bones, we've made it our campaign for the last few years to encourage women to ask for the medical test to see if there's any cause for bone loss. For example, if your doctor says this is such a serious problem, you should take a bone drug, then you can say to the doctor, look, if it's such a serious problem, we should certainly try to find out exactly if there's any cause for this problem. This medical osteoporosis workup that I've written up that's free on our website will list all the tests that the doctor should do if they think the bone loss is excessive. We always ask our clients to do that. If we find a problem like parathyroid or loss of calcium in the urine or low vitamin D or even just cortisol that is damaging bone, we work to correct that, and then you see if you cannot regain stability in bone. And certainly in our mind, and even in the minds of the Surgeon General who wrote a report a decade ago on how to treat osteoporosis, first you do lifestyle, nutritional things, then you look for secondary causes, and the drug therapy is last. We, however, have gotten confused, and we do drug therapy first many times. So the long and the short of it is, Lori, look to see if you're doing every single part of the program, and the first part of that program is there any hidden causes for this bone loss? And you may think you're doing supplements, but you may not be getting near the nutrients. For example, do you have any idea what the requirement is for potassium? It's 4,700, 5 times that of calcium practically, and it means eating 13 servings of fruits, vegetables, nuts, and seeds. Now, this is a government recommendation. Nobody does it. If everyone did it, we definitely would all alkalize and have better bone health. So sometimes we think we're getting a good diet. We think our supplements are okay, but they're not near the therapeutic range. If you go to betterbones.com, you can look up our 20 key bone nutrients. These are the 20 nutrients I've researched, to each one of them very documented to be linked to bone health, and it'll list for you the RDA, the therapeutic, as opposed to the ideal dose, the therapeutic dose, and it'll tell you just how common inadequacies are in our society. In fact, somebody suggested, one of the people here wanted to do a diet analysis, and that's a great idea. There's some wonderful computerized diet analysis. I think one of them is called the Chronometer, something like that. And you can actually do a diet analysis and see what the nutrient content of your diet is. The problem is that we don't know exactly what's in the foods. We know that you can take one orange and it may have 50 milligrams of vitamin C, another may have 2. And this, of course, brings us to the whole question of soil depletion and what actually nutrients are we getting in our food. However, also remember the signs and symptoms make a difference. If your gums bleed, if you black and blue, if you get leg cramps at night, if you have white spots on your fingernails, these are many signs and symptoms that you don't have adequate nutrients. And I have a nutrition detective questionnaire you can find on our website. That's helpful too. It's helpful to begin to see, I think I eat well, but how's my pH and what are my signs and symptoms? Let's see what else we have here. Let's see if we can find a simple question before we start answering any live questions that you have right now. People often ask me about the biodensity machine. How we build bone dramatically is through exercise, and particularly showing the bone that they need to be strong. The way we show the bone that they need to be stronger is by loading bone. For example, if I every day have the habit of, if I start picking up, a really heavy weight, it's going to tell the bones, hey, you need to be stronger because there's danger coming. There's these heavy weights coming down here. If I hop a lot and jump, I'm sending a signal of impact to the bone that says, you need to be stronger. There's demands put on you. Osteogenic loading, and we put, right now as I stand here, I have one times my body weight. If I hop up and down, I can have 2 or 3. If I jump off a table, I can have 4. When you get up to 4, you really send a strong signal to build bone. So there's some people that have developed machines. Certainly weightlifting machines can really load the muscle, especially if they're done right. When you load the muscle pulls on. You're loading the muscle and the bone, I should say more appropriately. So a very creative bodybuilder built a machine where you just simply sit down, they rig you up, and you press against this machine, or you lift your arms, or you push your legs, just like 3 or 4 movements that get very strong loading of the bone, put a lot of pressure on the bone. It's actually the bending of bone that sends a signal. Now, you don't want to bend enough to break bone, but when you bend it more than usual, that sends a signal for new bone to be grown. It sends a signal that there's danger out there. We have to get strong. This machine is called the Biodensity. Originally, it was called Biodensity. Now they franchised it, and I believe the name is OsteoStrong. And they are reporting nice gains in the spine and in the interesting thing about that, their gain, it makes sense that the machine would work somewhat. It makes sense that when you do it, you might gain bone, but when you stop, you're going to lose it, just like any exercise program. But their data, the data they present is very very dramatic gains, when I think the only study I can see is based on 11 people. So now we have an interesting thing. This Australian group I often talk about, the Australian Bone Clinic, I've written about them many times. They're in Australia, and they are taking older women and having them doing strength training right there at a center where they measure their bone densities, and they also have some university residents of physiology are coming down and help to make sure the exercises are done properly, the right form. And these older women are building bone nicely. So the Australian group has, in a sense, challenged these OsteoStrong people. They're going to take 100 men, actually, and they're going to compare their Australian program, which is a half an hour strength training, I think it was 2 times a week, maybe 3, who built nice bone, most people, with the OsteoStrong. So it'll be fun to see how that turns out, and I'll report it to you. What you know is that if you build muscle, pretty much you're going to build bone. And certainly osteogenic loading is important. And if any of you do the OsteoStrong, shoot us a note. They usually give you they usually measure bone densities every year, sometimes 6 months. I've seen some clients that didn't have much gain. Other clients got a little bit of gain. So let's see what's going on for you. Every case is different. And remember, we go back to the root of, are there any causes for my bone loss that would make it more difficult for me to gain? So that's about the OsteoStrong system. Let me see if there's anything else before we go to the basic questions. I think between the little YouTube we did this morning and this afternoon, we're kind of set up here. Alyssa, do we have any other questions right now? Okay. Let's see if we can go through a few more questions here. Is a level of blood calcium of 10.2 concerning? Doctor does not feel it means anything. So if you can look at your medical tests and it'll tell you the range right on it. 10, 10.2, 10.3. And you want to see if you're out of range. 10.2 is towards the high end. I'm not sure it's out of range on the particular lab test you did. But that goes in combination with parathyroid. And it also goes in combination with a loss of calcium in the urine. So you really, it's a little bit of a complicated thing. And I don't mean, I'm a nutritionist and I'm an educator. I don't mean to pretend to be telling you what to do, but I would try to get a physician, maybe an endocrinologist who understood more about it, to look at the urine calcium and the parathyroid at the same time as you looked at the blood calcium. And you yourself can check the ranges to get your blood test result and look and see what the high end the lab says is for that. This is Cindy Joe, who says, I have a T-score minus 2.6 in the hip and minus 2.5 in the spine. My doc wants me to go on Prolia. I have already done Forteo followed by a Vista and had a great gain, but went backwards after 8 years. Wow. So, Cindy, again, this is so interesting. The few things I can tell you, of course, everyone, if you take Forteo, it kind of tricks the body into building bone. You can only do it for 2 years because of the hazards that can be after that. When you stop Forteo, you will lose everything you gain, just like it seemed you did, unless you go on another drug. You went on a Vista, which is not really a strong drug, so it might not have been enough to halt the bone loss. But you said, followed by a Vista, it had a great gain, but went backwards after 8 years. So the loss might have been slower than usual. Usually people within 2 years lose everything they gained on Forteo, but you might have prolonged it out because of the use of another bone drug. Prolia is a new kind of bone drug. It works differently than bisphosphonates. It's stronger. It halts bone breakdown a great deal. And the interesting thing about Prolia is it's so strong that 6% of the people that take it develop spinal fractures when they stop it because there's like a withdrawal effect. Now, you may say 6% isn't a lot. 3% of those people get multiple fractures. So, but you know, Cindy, your case has to be looked at very carefully. Obviously, it's a very complicated case. You may have well had many fractures. You need to work very carefully as far as the nutritional things to make sure you've got every part of our program online, whether you do another drug therapy or not. And of course, maybe you can find a local functional doctor or a progressive nutritionist who can help you see to make sure all the tests were done looking for hidden causes of bone loss. There are some strange genetic situations. Once in a while you see people that just are prone to low bone density, an easy fracture. You might have seen this great person who attended our retreat a few months ago. She actually had 30 fractures so far in her life. Some sort of genetic situation where she fractures easily. No one can figure it out. But she heals every time, and she's doing pretty well. So, Cindy, good luck with all this. I hope you can do a nutrition program with whichever way you decide to do the Better Bones, Better Body program, not just any old program, with whatever you decide to do about bone drugs. I did already mention bioidentical hormone therapy, and it's not just my opinion. I mean, some of the major societies have said it's not really worth doing it's too risky to use for the benefits on bone. But then again, you know, I always say we live in a planet of free will. Everyone can decide what they want to do. If you have a family history of breast cancer, I'd be particularly careful with that. So, again, so Karen writes, and I have 2 Prolia shots and I want to stop this drug. Will I be okay? Changing my diet and taking my supplements like K2 and MK7. MK7 is a K2. So the first thing, Karen, I really can't tell you anything about what you should do about drugs or what happens if you stop it, but I would talk to the doctor about why I'm concerned about it. And again, we're going back to the question of what was the reason you had to take the drug? Can they identify any reason for you having a bone weakness? And certainly, even if you decide to keep up the drugs for a little longer term, be sure to look carefully at all our 20 key nutrients and look at the alkaline diet and look at the exercise programs. Don't just take a vitamin K and your supplements, because your supplements probably weren't working, I presume, because you had to take the Prolia. You know, Renee asked about genetics and osteoporosis, and that's really a very important question. Like I just mentioned, my client, who you can find, we've done a blog on recently, who 30 fractures. Well, this is obvious. And she had a great lifestyle. She had a very positive attitude, good diet. There was some genetic thing going on, and it can have to do with collagen. It can have to do with so many things. There's so many pathways to bone health and bone weakening. So what we do is we know that we can turn on genes with lifestyle, with nutrition, with avoiding toxins. So we just do our best with all that. And it certainly is possible that in the future they're going to uncover many more links, genetic links. But don't be so concerned. If your parents fractured or your grandmother fractured, it doesn't mean you have to fracture. But it may mean you have to do something different. Use the knowledge we have about the nutrients, about the alkaline diet, about exercise, and about a positive attitude. Even being stressed out, you can produce enough cortisol in your body to damage bone. We always ask people to test for cortisol if they feel under stress, and we ask people to meditate. We all need to quiet down our nervous systems and be happy. That will definitely help bone. Well, it's my great pleasure to talk with you all. We'll try once in a while to answer the questions. I hope you all stay stronger longer. And just to say, we're doing these retreats. We do them every 6 months. They're a lot of fun. Small groups of people get together. This is the first year we'll be having some men at the retreat. It'll be really fun to work together to go through every step of the Better Bones program. So if you're interested, come on, join us in Pennsylvania in May, and we'll have 4 days learning everything about building better bones and a better body. It's my pleasure. Be well. Talk later.